Hello, my name is Gregory Proctor, and
I'm Lawan Proctor.
we are continuing with my instructor skills checkoff. The BLS has already been submitted, so we're here to do the ACLS mega code and the PALS scenario. All right, Lawan. Today we have an admitted patient in the hospital. She's 42 years of age. She has a history of lupus and asthma. She's here for pneumonia. She was doing well initially, but she's had sustained tachycardia for a couple of hours now while receiving albuterol for ongoing wheezing. Her heart rate has stayed in the 160s. The blood pressure is 140 over 70. She has a fast respiratory rate, and her oxygen saturation is like 87%.
Okay, hello. Is there IV access? We're making sure that we are on the monitor, blood pressure, cardiac monitor, pulse ox. Any
Yes.
allergies?
No allergies.
Oh, okay, so we do have IV access.
Yes.
All right, so I know it's not really the best scenario to give adenosine, but I want to try to slow the heart rate down. I'll talk to the patient, let them know that it's going to be a fast 6 milligram IV push of adenosine with a flush to back it up to the closest port. And we're putting that in. Did that break the SVT?
So now the patient is showing in sinus rhythm, but their breathing is worse.
Okay, so I'm going to go ahead and just assist them with some breathing by bagging the patient at one breath every 6 seconds. So we're going to go ahead and do some bag BVM, and maybe I'm going a little too fast.
Well, no, I think it's fine to do once every 3 seconds because you're good right there.
So did this help the respirations at all? And what is our rhythm at this time?
So we're showing sinus rhythm on the monitor, but one of your imaginary partners does not feel a pulse now.
Okay, so we're in PEA, so we're gonna call some help, and I'm gonna get some compression started, and we have everybody alerted to come, and someone's taking over the airway. Okay, someone's taking over compressions for me. AED is coming in. We're just gonna go ahead and put the pads on and cut the AED machine on because we're still waiting for more help. So this is.
And while your one partner is here, is there something that you would like them to do while you're hooking up the AED?
Well, we can continue. Well, we have people doing the BVM. We have compressions going on, and we're going to give. We're going to see where we are first. We can give 1 milligram of epi.
Analyzing heart
Okay.
rhythm. Do not
Compressions
touch
are
the
going.
patient.
Okay, we asked them to come off the patient so the analyzing can go. So
Shock advised.
okay.
There's no shock advised, actually.
Charging.
Okay, so this is not going to happen because we're in
Stay clear
PEA
of
and you
the
don't
patient.
shock PEA. So we're going to cut that off, just demonstrating that we would see if we needed to do anything, and there's no shock advised. But we're still doing compressions. We've had 1 milligram of epi put in, and we are getting someone to come and give us advanced airway, but we don't have that just yet, so we're just bagging.
And we're at the 2-minute mark now.
Oh, okay. So what is the rhythm?
What VTAC, excuse me, VFib is on the monitor now.
Okay, so now I'm going to turn the AED back on, and we're still doing compressions. And since we're past
Analyzing heart rhythm.
Okay, everybody's coming off really quickly.
Do not touch the patient.
Okay, analyzing.
Shock advised.
Okay, we're charging, so we're doing some more compressions. Someone
stay clear of patient.
Okay, now I'm clear, you're clear, we all clear.
Deliver shock now. Press the
Everyone's
orange
clear.
button.
Okay, everybody's
now.
clear. All right, so
shock delivered.
We delivered the shock back on CPR.
Begin CPR.
And we're actually switching partners, and we're giving a milligram, 1 more milligram of epi. Since we're past that, we did the milligram for PEA. Now we're doing it for VFib. We're continuing, and if we got to our have we gotten to the 2 minutes?
So at the 2 minute mark, there is a pulse present, but the patient is not breathing on their own.
Okay, so we're going to do some rescue breaths at this time, and we're still waiting for someone to come and intubate for us, and we're doing 1 breath every 6 seconds. Okay. Did that help? Has someone arrived yet for intubation?
Yes, the anesthesiology team is here to relieve you from the airway.
So we are putting a tube in here, and we're checking the tube in to make sure we're in the right spots. We're checking the abdomen and making sure we're getting bilateral chest rise, and we have ourselves hooked up. And are we still perfusing? Do we have a pulse still? Or?
Yes.
Okay, and how is our airway? And we're doing Ross now.
Okay.
Okay, so now we are doing some maybe normal tensive, things for our temperature. What is our we're making sure we check our blood sugar. We have the vent settings per order of the physician. We are making sure with our blood pressure. Do we have a blood pressure that's
100 over 60, and the glucose is 180.
Okay. And now we have transported this patient, because they were in a regular room, to the ICU, and we're still monitoring things as we go. Labs have been sent off. Urine have been sent off.
And is there, you said additional items, is there anything specific that's going to help you make sure that the patient?
We got to make sure that we have capnography. Okay. We have capnography in place. We have IV access. And we've already sent off labs. We have vent settings per doctor's order.
Okay. Thank you. And we're just going to quickly reset here. We're going to transition to our PALS scenario in just a moment here. Okay, so that can stay there.
We'll go here. Here's the okay.
Right. And so for our PALS scenario, we have a mother that has brought her 4-month-old baby to the ED. Poor feeding, very lethargic, looking very listless, just not very lively. Went to the pediatrician 2 days ago. No improvement since that visit.
Okay, so we're going to have a pediatric settings monitor here, and going to talk to...
Oh, no, just to let you know, you have any imaginary partners at your full disposal.
Okay, going to get some history from mom. Going to pull out the brass Broslow tape and manage from the heel to the head. Measure from the heel to the head. And we're coming up with the baby is 4 kilograms. We're going to go ahead and put a 20 gauge IV in to the baby so we can do possibly fluid that's needed. And we're asking about allergies, history, any current illnesses, any past illnesses or chronic illnesses as far as congenital with the baby. And we're also going to get mom to be there for support. So, what is our breathing? What is our vitals for the baby?
So the blood pressure is 60/30. The airway, your partner assessed was open. The breathing is a little labored, and the brachial pulse is just it's there, but it's a little threatened.
So what we're gonna do now is we're gonna have a little blow by oxygen going on, and we have the IV that is patent. So we've started, and since the baby was 4 kgs, we're going to just do something small as far as 5 to 10 milligrams per kilogram. So we're just gonna go ahead and start with 20 for the bolus, and we're gonna move it kind of slow because we want to make sure that the baby's getting resuscitated without having the overload of fluid to compromise the breathing even more. And we're going to reposition the baby, get the baby comfortable. We've called the pediatric specialist to come in. So where are we? We've got the bolus going, it's going in slowly, and we're reassessing to make sure once the bolus is in that, we're checking, lung sounds and things like that to make sure the baby isn't getting too overloaded. And we're also assessing the breathing. What is our breathing doing to make sure it's just not, the fluid is just not too much. We have a Barotraol on as well to monitor our fluid.
So you do not hear any rolls or crackles, but the BP is now 55 over 36, so a little down from the last time systolic wise.
So what we might have to do is do something to help with the blood pressure, and we would look on our Roswell tape. So we have established that it was a 4 kilogram baby, that what we could possibly use to not, I believe we could do, what is our heart rate right now?
The heart rate is 180.
Okay, so that's kind of normal for babies, but it's a little bit elevated. So we're gonna keep our fluids going. We're gonna keep our fluids going. If there's a doctor order for maybe some vasoactives, we will do it per doctor's order, per kilogram, based on a Broslow tape. Right now, we're just going to continue to monitor with the fluid boluses to ensure that is helping to bring the pressure up with the baby.
So the doctor's order, the goal, I just want to be clear, the goal is to bring up the blood pressure.
To bring up the blood pressure and continue the fluid boluses and monitor them very closely to make sure that we're not fluid overloading, and to see if we're having a therapeutic effect with the fluid boluses. If we're not, per doctor's order, we'll do a vasoactive that is appropriate for this 4 kilogram baby. And there's a yeah.
Well, we'll have the doctor's order. So thank you very much.
Okay.